So I will take just overview. I'm here to be, I want to listen from your side. I know very well you're already trained, so I need to understand what is exactly challenge you are facing here. And what we are, our recommendation about our software to keep you on the safe side and the patient side. And our purpose always improve the patient safety, minimize the human mistakes and patient risk. So the first step when you take the sets from the package, this is the basic. You have to squeeze 10 to 80%, and you have to brine. Okay, I come here just to brine because I see some bubbles here. Open the roller can and let's brine. Okay, you can see. Okay. Now, so what is the next? What is the next step? This is interactive session. I will not give you instruction. Just I want to listen from your side. You know how we can attach?
Yeah.
So the important thing when you attach, you have to catch with 45 angle degree. I see here, because I did many sessions in acute care, the important notes here, I see many contamination here, and it's not clean. So our advice to keep clean, to keep safe, and because also after days you will see change in color. The color contamination change blue to green, so that will be not good for the adult. So this is the first note. The second note, sometimes when you take and attach the module, it will be fall down. Don't use it. You have to send it directly to paramedic, even if there is any change in color here. Okay? So 45 angle degree, then close. Okay? Deattach also. Also, I see the IV stand here. It's not fixed. So that will be not good for the transfer the patient. Transfer, sorry, the bulb, even if it's connected to the patient. Now, the best way to load the sets as a proper way, you see, as it's color coded, so it's easy to you to load the IV sets as well. Anyone know why we BD build this safety clamp? Yes.
Overload. Overflow.
Yes. It's include the line for the free flow. Okay. So once you load the sets, I'm just here just to refresh, remind you. Now I will not speak. Okay. Push the tube fair enough. I think this tube will damage later on. Okay? Here what I mean, the safety clamp. This is a safety clamp. You can see it's already closed. No bullets, no coming fluid to the patient. Now, are you use here basic or a drug library? When you start running the medication? Drug library. Excellent. So this is our recommendation to use always the Gardens software. Gardens, the name Gardens, this is our software. Gardens fluid, Gardens drug. So I will start. So what is the challenge? What is the challenge here? What is the main problem you see with
Channel
Alaris?
error. Channel error.
Channel error. When? Last time?
During the past time, I faced it a lot, especially with the machine that not charged or not connected with electricity. Like for example, if it's not connected for long time, it will give you channel.
Okay.
Channel.
So we have to keep it plugged in. charged. If not, if we will not keep it charged, yes, as you said, it will be reduced the battery because depend on the rate, because sometimes the rate consume the battery.
Yes.
So regarding to channel error, so I will back to this point. It's very important. So I will just back to the new patient. This is the first message. If that a new patient, I will press yes. I will press no. Okay. If you press no, you can see the profile here. Okay. This is profile. That means if I work in adult, pediatric, in ICU, I will find my profile. My profile, the medication that related to this unit, the medication concentration that related to this unit. So the drug library here is customized per profile. Okay? Now, so what is here? Adult critical care? Okay. I will back to your question regarding the patient ID. We refer to the medical number and confirm. Now, yes. Regarding to the channel error, before we did as remediation.
Okay.
It changed the shape from the Care Fusion to the BD, and it changed the software. So before the version was 9.33. Now it's 12.1. So when you start this project, the big project with more than 3,000 pump, there is a mix. There was mixed between old and the new.
And the new
That
one.
makes
So this is
channel error because it's not compatible.
Okay.
You take 9.3 and upload it or attach with the 12.1. Of course, it's not convertible. Here you will find, as I said, this is the version, system configuration, sorry, option, I will just check. Software version. You see here, it's 12.1. Now, channel select. Why you are far away from me? Please, come. Don't worry, I don't eat. Now, yes, tell me. This is the 3-way to running your medication. Basic, Garders, and the Garders drug. So as I understand, you already use the Garders drug.
Yes.
So how about the severe cases? If you want to use basic. If the medication not listed here. So don't use it unless you have severe, critical. Okay, and I will teach you how you can find another technique. If there is a severe, and I want to transfer the profile patient to the guarded software. Okay, now let's say I have, give me any severe cases please. Any severe.
Trauma code, passive and transfusion.
Trauma, yes.
And
My question here
navigation,
just to be
cardiac
more
arrest.
quick up, okay, I understand. Now, channel select. Guarders, no guarders, okay? We are not recommended to use this one. But I start with the basic, because I understand there was an incident happened before 2 months regarding paracetamol. In case, if in severe cases, and start with the primary, the basic, you can put like say 500, the duration, let's say 3 hours, whatever. Or you can diminish, you can put the 30 minutes, it will be increased, okay? Depends on. So I will keep it here, just don't like to lose the normal saline here. So you can see here, the rate automatically programmed, and start. Now, I will go to channel select, I will keep it 0.1. No need to lose all the normal saline here. So you can find here only the basic and the rate, no medication label here. So what I have to do, go to channel select. I want to transfer the patient to the another medication, and I will keep him in the same guarded software. Okay? Go to option. Read. Guarded drug or guarded IV fluid. If you want to come here, no problem. Guarded drug or guarded IV fluid. Anyone. If I want to back to the guarded drug and I want normal saline, you can put the volume duration, depend on the, let's say 3 hours, and start. Now this message, that means you transfer already the patient, transfer from the basic profile to the guarded. Now, the duration change result in recalculation of rate, and press yes. Now, you will be in the normal saline, in the guarded software. Very important. Okay? It's clear. Any question? Okay. Channel off, channel select. Give me any medication, the most medication you are using. Ceftriaxone. Excellent. So it will be easy to you to find where is your medication by alphabetical. Page down, Ceftriaxone. Now, is that concentration suitable with you in this department, or you have another concentration?
No,
There is
basic concentration.
1000 in 50 and there is 1000 in 100.
Think. If it's okay,
Mm.
so no concern about the Ceftriaxone.
Yes.
If I have concern, I have to back to the head nurse here and request the, as I see now with the Mr. Muad, if they have concern, they have to back to Mr. Muad, and Muad will delegate this information to Abdurrahman al-Maghrabi. Dr. Abdurrahman al-Maghrabi, he is the informatic pharmacy. Okay? Now, again, channel select. I will back again because I didn't check Ceftriaxone. So 1000. This is a checkpoint.
Yes.
Ceftriaxone mil based on your bag medication. And next, how about the rate? 100. Everything it will be calculated and start. Just to remind you why we use the guarded, because we have hard and the soft limit. Hard limit and the soft limit. So if I back to the rate and I want to change the rate to the 500, let's say, let me see what reprogram. This is the hard limit. No problem. So this is reprogram. That means you are exceed the limit, the accepted limit. You have to back to the 200 milli per hour. Okay? 200 milli per hour. This is the soft limit, accepted dose, but it's not the initial dose. So I have to reprogram to the 200. Sorry. I will back to the 200 and start. Okay? Now you are back to the normal dose. Any question?
Thank you.
Okay? No question? Okay, I will use another medication. Let's say amidron.
I'm not using a mitral.
You don't use
Yeah,
medicine?
research people
Which
they are
medication?
using.
Give me another medication.
Nitroglycerin.
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 Okay. I admire, I love this message. I'm not using the nitroglycerin
We
or
are
whatever, the
using,
amidron,
we are
like for
using,
example.
but some there is a distribution of area.
So how about the nitroglycerin? Which IV set you are using with the normal saline? Sorry, with the IV sets?
There is
No,
different IV
so-
sets certainly.
No.
Low absorb.
Excellent. Only the low observing. And I understand the situation here, some shortage,
Yeah,
but keep,
whatever there you
Yeah.
can use.
if you raise the complaint
Mhm.
about the shortage, it will provide the low observing sets. So no spare in that.
Yeah, purchase only.
Sometimes the primary, I won't use the primary, so we are always recommend to use the low absorbing in the low nitroglycerin insulin. Okay, if there is any shortage, you have to back to the head nurse, yes, to the company and head nurse. We can find a solution to support you. This is what I mean for the no spare. Now, tell me nitroglycerin.
Nitroglycerin.
So where in A, F?
Okay.
Yes, you're right. Nitroglycerin. Where is the nitroglycerin? Okay. Let me check the concentration. Yes. Yes, here. So, non-weight or weight? So, non-weight, the ml per hour.
We have 150.
Is that fine, the concentration here?
Yes.
Excellent. So, 50,
Yes.
the same message. This is the clinical advisory message from the pharmacist to the nursing based on the hospital guideline, hospital protocol.
Hospital bills.
Okay, critical care, use non-PVC tubing sets.
Yes.
Confirm you have to use all this drug library. Just, that's fine. Which the dose? Give me the normal dose.
Yeah.
10 mic.
10 mics. 10 mics most likely.
10. Excellent. Volume to be infused?
And 250.
250 and start. Okay.
Per hour.
So no challenge here in the nitroglycerin.
Yes.
So, okay. So give me the last one. I want to say the last point.
Fentanyl infusion.
Fentanyl. You have fentanyl.
Yes.
Okay.
Yes, in the thermocol.
So I will back. It will be the same for the fentanyl. Nitroglycerin, fentanyl, whatever. Any concern about the concentration, you have to back. If in severe, basic infusion. Start use basic, then transfer directly to the guarded software in option. Okay? Another question. Another concern. How about the if we can support and add safety feature about the extra position? Here in the bump. What?
It's already
Oh, sorry.
going up.
Stop. Pause.
Yes, you're right. Okay. Keep it.
Make it some, otherwise it will alarm.
No. I need.
Okay.
Thank you. So that's good. You can see the delay option here. Okay. Because I moved my hand. Start. Let me check. So here, start again. Can you check the cross line? The
Yeah.
cross line, this is the pressure.
Yeah.
It's reading around 300 millimeters. So we are not always recommend to use the hospital precaution about the extra position. Just here to tell you, we can make the pump as early alarming to find the occlusion. Just go to the channel select and option. You will find the pressure limit here. The pressure limit reading 300 millimercury. So here, depend on the situation. So this will support you to find and to help you. Just go down. If I want to increase, let's say, the pressure to 100, can you check the cross line right now?
Yeah.
Now it will be more closer to the patient side. Okay? Coming? Yes. Now the line, it's more. So if there is any occlusion happen, I will not wait till 300. I will wait till 100. Okay? This will support you. Depend on the situation. Okay, restore, and I will start again. So last point. So you know very well the tamper resistor behind this PCU.
Yes.
Before this panel lock out or panel lock, just press 5 seconds, and it will be closed. Yes, it will be closed. You cannot change. So why we want this panel lock? Do you use it or no?
Yes, because sickler patient, they know how to manipulate with the system,
Excellent.
so we have to be
So
channel
to avoid, yes, the family
To
member
avoid
any play in parameters or change.
to change.
So
yeah.
don't let them what you are doing here.
Mm.
Just close panel lock and start again. Channel select. Okay. Any question?
Thank you
This
so much.
the pressure limit, you start the infusion and then you go back to the pressure limit for infiltration.
For the
Precaution.
this is support you if you want to
Yeah,
increase or decrease.
Yani, this is my question. After the start infusion to go for the pressure limit or before?
Come, please. I will start it from the beginning. Don't worry. This is a good question. Go to the restore.
Okay.
Go to the next. Yes, go ahead. Next.
Mm.
And go to the option.
No, that I know. My question is it start before the infusion or after?
Yes. Now go to the option.
This is option delay.
Option, not
Ah,
option.
okay, sorry.
No problem.
Okay.
So because I changed already that one, you can use before. Depend on what
Okay.
you want.
That's all right.
You want to use before?
Mm.
Let me. I will back to the 300.
Mhm.
Keep it after. Just confirm. Start. Now see the cross line.
Mm.
It will be back. Just let me take time. No.
All right.
Before
Mm.
it will be here.
Mhm.
Okay.
Mhm.
Now go to the option. Channel select option. No, here no. Channel select.
Yeah,
Yeah, channel select and option. go to the pressure limit, and you can select it
Yeah.
up or down.
All right.
Before maybe someone maybe change already the pressure limit.
Yes,
So
to
just
make sure.
to make sure,
Mm.
just to start when you see the cross line as well as default 300 millimeters. If you don't have a question, Amin. Now, most welcome. You are not yet? Okay. Okay. Always remember, use the guarded software Allah Hafiz. Always remember, guarded software is very important. You have the basic emergency, transfer to the guarded software. Okay? To protect your side and patient side. Thank you so much.
Thank you, sir.
Thank you.
If you need any, if you have any concern, just back to the Mr.
Thank you, sir.